fractures and how it affects running. So what I wanted to do is I brought my good friend, Mr. Super Skeleton, out today to kind of go over where stress fractures can commonly occur in runners. So one thing that we know, when we always hear about stress fractures in runners, we tend to look actually at the lower leg. So we tend to look here at the tibia as being the primary area where the stress fracture occurs. But the other common area is actually what's known as the tarsals, which sits here in the foot. Then we look at actually the upper part of the femur, a lot of times right here at the ball and socket. And then the other area we look at a lot of times happens to be here, which is the sacrum, which is where the lumbar spine meets kind of the tailbone area. So you'll see the triangular bone right here, here's the coccyx, and then the lumbar spine. So these are the four common areas where stress fractures can occur in running, all because running is a very repetitive motion, and as we're prepping a lot of times for the half marathon or marathon or even ultra race, what happens is when we increase that volume, when we increase that intensity, the force that's coming along the body just starts to create micro kind of tears and cracks in the bone, leading to a stress fracture. Now, there are things that we can do while we're recovering from the stress fracture to help us with that injury prevention that's so important, getting us set. So when we embark upon returning to the running, when we start kind of getting that mileage going again at an easier pace, we want to set our bodies up for having good biomechanics, proper muscle strength, so that way that these four areas never seem like they're getting irritated again, or worse, creating an actual fracture to the bone, setting us back even further. So those are the four common areas where stress fractures can occur in runners, all due to the fact that we've increased the volume and intensity of our training, pretty much because now we're looking at doing a longer duration event. So now what I want to do is I want to go ahead and show you guys some things that you can do from a soft tissue and exercise kind of prevention side that can help during this recovery phase while you're trying to figure out how to return to running from those stress fractures. So here we go, we're switching over to that part. Okay, so like I said, there are a few things that you can do while you're recovering from those stress fractures to really help kind of strengthen not just the bone, but also get you set for when you do return to running, that you're not going to go ahead and create more of an injury or make that fracture actually worse and create a true fracture versus just a stress fracture. So like I said, one of the main areas that you can get stress fractures when running is really along the shin. So that's where we look at this muscle here. So the main thing to do when obviously we want to go ahead and really heal ourselves from the injury is start to look at where the injury is, and then from there address the soft tissue. I've talked about this before, but a lot of us actually don't understand how to properly use foam rolling. So that's what I want to first talk about is foam rolling. So hopefully many of you have a foam roller at home if you're a runner, and some of you may have ones that have nodules on them. They may be a little bit more intense in terms of the density, might be a lot harder. It's all up to preference, but what we're going to do is we're going to go through the main areas based upon the four common areas where you can get a stress fracture. So let's go ahead, we're going to start with the sacrum, kind of low back area first. So go ahead, place your foam roller down on the ground. You're going to go ahead, you're going to sit essentially down on the ground, place the roller at the small of your back. From here, you don't want to lay over the roller. You actually want to go ahead and press the small of the back into the roller, keeping the arms crossed over, and you really want to just kind of rock back and forward right here, just like this. So you're going to rock nice and easy back and forward. You're going to feel your abs engage, and what you can do is go ahead and get into one side by leaning a little bit and then coming over and leaning onto the other side. From there, we want to address our piriformis. So you're going to go ahead, hop up onto the roller. You're going to cross one leg over the other. For purposes of the video, I'm going to show with my right side, making a figure 4 position here. Right hand is on the floor. Then you're going to lean into that right buttocks. without getting a kiss from the dog. Okay, so now go ahead and sit onto that right butt cheek. And right off the bat, what you're doing is you're putting tension on that piriformis muscle, allowing it to become more exposed as you roll, and you gently kind of rock up and down on that area. So now you've done your low back, then you do your piriformis. The next is to actually get your TFL, which sits up high, and then matriculates all the way down into the IT band. So you're gonna go ahead, roll right onto the side. From here, you're gonna go ahead, cross one leg over the top, the bottom leg stays nice and straight. You wanna go ahead and just lay on it first. When you put the pressure on it, you will feel kind of some, tenderness. That's because all of us don't have a lot of fat on this area. It's a more exposed area. So from here, we're gonna put the other hand on the floor, and then we're gonna lift that back leg up off the floor as we roll out, getting that roller closer and closer to our knee. So we're gonna come here, notice that I'm leaning forward just a little bit, and the more you take the leg, the bottom leg that you're rolling off the floor, the more intense you're gonna make that action. Now, we've addressed the sacrum, we've started addressing the femur by also addressing the piriformis, the TFL, and the IT band. Now we're gonna address your shins. So what you're gonna do is, you're gonna kneel on the roller, okay? So I have my shins now on the roller. From here, I'm gonna place my hands on the floor. I'm gonna splay my knees a little bit, allowing those shins, allowing that anterior tibialis to kind of really rub and get into that zone. So I'm gonna go ahead and just rock back and forward. If you wanted, sometimes just putting pressure just like so will be enough. You could put your hands up on a bench or a table and just allow yourself to kind of sit and again, just enjoy that motion as well. Now, even though the stress fracture is more, say, in the tibia, you still want to address your calf and your peroneals here. So what I mean by that is you actually want to address your calf muscles, and then you want to address your peroneals here on the outside. So the way we're going to do that is we're going to come down, and again, I'm going to show you just using my left leg. You're going to put the left leg out on the roller, stack the feet like so. Go ahead, pull the toes towards you, pop that body up, and then go ahead and lean into that outer side, really getting that calf, and then coming over and still trying to get in towards that soleus as well. You don't just have the gastric muscle that makes up the calf, you also have the soleus as well. Now, if the stress fracture is more in the metatarsals, you can go ahead and just start rolling out the foot alone on the ball. You just take a lacrosse ball or tennis ball and you start massaging out that area there. Now, that's what you want to do from a soft tissue standpoint, which will make a huge difference as you're recovering. The next thing that you can do is you want to start strengthening the lower leg. And how we do that is by doing heel raises and toe raises. The simple way to do it is to actually walk on your toes for the length of a room, and then also walking on the heels for the length of the room. So when we walk on our toes, we're specifically working our calves, and when we walk on our heels, we're specifically working our shin muscle, our anterior tibialis. But notice something, that as I do those motions, I'm not tilted forward whatsoever. My posture is up nice and high, and I am engaging my glutes as well. Now, if the stress fracture is more into the hip, say the femur area, the one exercise you do want to start with immediately is what we call more stabilization. That's simply just coming down onto the ground, laying onto your back, placing the roller in between the knees or your yoga block, resting the upper body comfortably on the floor, and just holding and squeezing and allowing the hips to actually reset themselves for 30 seconds. So that's where you would want to start there. There's many more exercises that you can do based upon where that stress fracture is. So if you have more questions on what to do for your specific injury, like I said, drop a comment below and I will go ahead and assist you there. All right, everyone, this is Dr. Heather. We are talking about stress fractures as it pertains to runners, looking at the 4 different areas that a stress fracture can happen in: metatarsals, meaning the feet, then looking at the shin, the tibia, then looking at the femur, that's your upper thigh, and then the sacrum, which happens to be more looking at low back, kind of pelvis area. And again, like I said, if you have more specific questions regarding the stress fracture as it pertains to you, just drop a comment below. Talk to you all soon.